The H5N1 strain of the avian influenza virus, commonly known as bird flu, has been a public health concern for nearly 2 decades. While outbreaks predominantly affect poultry, there have been instances where the virus has crossed species barriers, infecting humans. Though human cases remain relatively rare, the potential for H5N1 to cause a pandemic persists, making it vital for people worldwide to understand the symptoms, risks, and preventive measures. This blog will delve into the key aspects of H5N1 infection, from symptoms to risk factors and prevention strategies. Understanding human H5 bird flu. What is H5N1, avian influenza? H5N1 is a subtype of the influenza A virus that primarily infects birds, particularly wild waterfowl and poultry. It is part of a broader family of viruses that can occasionally jump from animals to humans, a process known as zoonosis. H5N1 was first identified in 1997 in Hong Kong, when an outbreak in poultry infected humans, resulting in 6 deaths. Since then, the virus has spread globally, causing outbreaks in various parts of Asia, Europe, and Africa, WHO, 2021. The virus's structure is similar to other influenza viruses, but the hemagglutinin, H, and neuraminidase, N, proteins found on its surface have unique properties that allow it to infect birds. H5N1 is classified as a highly pathogenic avian influenza, HPAI, which means it can cause severe illness and death in infected birds. When transmitted to humans, H5N1 can lead to serious respiratory illness, and if untreated, can result in fatal outcomes. How H5N1 affects humans. The human infection occurs when a person comes into close contact with infected birds, bird droppings, or contaminated environments. In rare cases, human-to-human transmission can occur, though it is not as common as with seasonal flu viruses like H1N1. This limited human-to-human transmission has raised concerns among scientists that the virus could mutate, allowing it to spread more easily between humans and possibly lead to a pandemic. Human infection with H5N1 typically leads to severe symptoms, including high fever, cough, and muscle aches. It can progress rapidly to pneumonia and organ failure, which is why early detection and treatment are crucial. 2. Symptoms of human H5 bird flu. Early symptoms of H5N1 infection. The symptoms of H5N1 infection are similar to those of other types of influenza, but they often worsen more quickly. Early symptoms typically appear within 2 to 8 days of exposure to the virus and may include fever, over 38 degrees Celsius or 100 degrees Fahrenheit, sore throat, muscle aches, cough, fatigue, shortness of breath, chills and body aches. Some infected individuals may also experience gastrointestinal symptoms, such as nausea, vomiting, or diarrhea, though these are less common in comparison to respiratory symptoms, CDC, 2020. Severe complications. H5N1 infection can progress rapidly, especially in high-risk individuals such as the elderly, children, or those with compromised immune systems. Severe complications can include pneumonia, a potentially life-threatening infection of the lungs. Acute respiratory distress syndrome, ARDS, a severe form of lung failure that requires immediate medical attention. Organ failure. The virus can damage multiple organs, including the kidneys, liver, and heart. Secondary bacterial infections. Bacteria can take advantage of the weakened immune system, complicating the course of the illness. The mortality rate for H5N1 infections is significantly higher than seasonal influenza, with estimates ranging between 60 to 80% in some outbreaks, WHO, 2022. Distinguishing symptoms from seasonal flu. The early symptoms of H5N1 can be difficult to differentiate from seasonal flu, making it essential to seek medical attention if there is a history of potential exposure to infected birds. One of the key differences is the rapid progression of symptoms in H5N1 cases. If respiratory distress or pneumonia develops within a few days of illness onset, healthcare providers will suspect avian influenza. 3. Risk factors for H5N1 infection. Exposure to infected birds. The primary risk factor for human infection with H5N1 is direct or indirect contact with infected birds. This can include exposure to poultry in live bird markets, farms, or during the slaughtering process. People working in the poultry industry, such as farmers, slaughterhouse workers, and veterinarians, are particularly at risk. During major outbreaks, human infections are typically associated with close proximity to poultry, especially in countries where biosecurity measures are lacking. FAO, 2020. Migratory birds also play a role in the global spread of H5N1. These birds can carry the virus without showing symptoms, facilitating long-distance transmission. H5N1 outbreaks in wild birds have occasionally led to infections in humans when people come into close contact with these birds. Travel and geographic risk. While human cases of H5N1 have been reported worldwide, certain regions are more prone to outbreaks due to the presence of infected birds or the lack of proper monitoring systems. Countries in Southeast Asia, such as Thailand, Indonesia, and Vietnam, have been major hotspots for H5N1 outbreaks, though the virus has spread to other parts of the world, including Europe and Africa. WHO, 2021. Travelers to areas experiencing avian influenza outbreaks should exercise caution. The World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, recommend avoiding contact with live poultry and practicing good hygiene when visiting poultry markets or farms. Human-to-human transmission. Human-to-human transmission of H5N1 is rare but possible. Cases of familial transmission have been documented, suggesting that close contact with an infected individual can sometimes result in the virus spreading. However, sustained human-to-human transmission has not been observed in the general population, and the risk remains low. Researchers continue to monitor the virus for mutations that could allow it to spread more easily between people. CDC, 2020. Vulnerable populations. Certain groups are at higher risk for severe disease outcomes from H5N1. These include young children and the elderly. These individuals have weaker immune systems, making them more susceptible to severe illness. Pregnant women. Pregnancy can compromise the immune system, increasing the risk of complications. People with chronic conditions, for example, diabetes, heart disease, lung disease, may face a higher risk of severe infection. 4. How H5N1 is diagnosed and treated. Diagnostic tests. The diagnosis of H5N1 infection requires laboratory tests, as its symptoms can mimic those of other respiratory illnesses. Healthcare providers may use the following diagnostic methods: PCR, polymerase chain reaction. This test detects viral RNA in respiratory samples such as throat swabs or sputum. PCR is the most reliable method for diagnosing avian influenza. Serologic tests. These tests detect antibodies in the blood, confirming past infection with the virus. It is crucial that healthcare workers suspect H5N1 in individuals with flu-like symptoms who have a history of exposure to poultry or areas with known outbreaks. Treatment options. There are currently no specific antiviral drugs approved solely for H5N1, but several antiviral medications used for seasonal flu can help reduce the severity of the disease if administered early. These include oseltamivir, Tamiflu, and zanamivir, Relenza. These drugs can reduce viral replication, but they are most effective when given within 48 hours of symptom onset. Antibiotics. These are prescribed to treat secondary bacterial infections, which can occur when the immune system is weakened by the viral infection. In severe cases, hospitalization may be required, with treatment potentially including mechanical ventilation and intensive care. Prognosis. The mortality rate of H5N1 remains high compared to seasonal flu, especially if not treated promptly. However, with rapid diagnosis and treatment, survival is possible. Studies have shown that early administration of antiviral medications can significantly reduce the risk of death, CDC, 2020. The prevention tips for H5N1 precautionary measures for those in high-risk areas. People living or working in areas where H5N1 outbreaks are occurring should take the following precautions: avoid contact with sick or dead birds. If you are a poultry worker, wear protective equipment such as masks, gloves, and eye protection. Practice safe food handling. Ensure that all poultry products are cooked thoroughly to an internal temperature of 165 degrees Fahrenheit, 74 degrees Celsius, to kill the virus. Follow local health advisories. Stay informed about outbreaks and adhere to government guidance. Personal hygiene and infection control. Good hygiene practices are critical in reducing the spread of H5N1. Wash your hands frequently with soap and water, especially after handling birds or their droppings. Disinfect surfaces that may be contaminated with the virus. Cover your mouth and nose when coughing or sneezing to prevent the spread of respiratory droplets. Public health recommendations. Public health measures include controlling the movement of infected birds, enhancing surveillance in poultry populations, and vaccinating at-risk individuals. The development of a vaccine for humans against H5N1 is ongoing, but as of now, no universally effective vaccine exists. WHO, 2022. VI. What you can do to stay safe. Stay informed and follow health guidelines. The best way to stay safe from H5N1 is to remain informed about current outbreaks and follow the guidelines provided by local health authorities. Organizations like the WHO and CDC regularly release updates about the global status of avian influenza. Support for local and global prevention efforts. You can contribute to reducing the risk of H5N1 transmission by supporting policies and practices that improve poultry biosecurity and promoting responsible farming practices globally. What to do if you suspect infection. If you suspect you have been exposed to H5N1 and are experiencing flu-like symptoms, seek medical attention immediately. Early treatment with antiviral medications can make a significant difference in the outcome. 7. Conclusion. Human H5N1 infection remains a serious health concern, but with increased awareness, proper precautions, and effective medical responses, the risks can be managed. Understanding the symptoms, risks, and prevention strategies is essential for minimizing the spread of the virus. By staying informed and following recommended safety practices, individuals and communities can help protect themselves from this